My name is Jill Kanaley, and I am a professor here at the University of Missouri in the Department of Nutrition and Exercise Physiology. So I did my undergraduate degree at Queen's University in Canada, and it was in phys ed with a minor in biology, and then I went on to the University of Illinois for my master's degree and PhD, and both of those were in exercise physiology. And continued on with two postdocs, one at the Mayo Clinic in endocrinology and metabolism, and one at the University of Virginia in internal medicine endocrinology. So my area of research is endocrinology and metabolism, and I focus on obesity and type 2 diabetes. And of course, being an exercise physiologist, I tie this all most often using exercise, but sometimes I look at dietary manipulations. Looking at this, I focus on glycemic control at this point in time and how we can manipulate diet and exercise to hopefully improve glycemic control in type 2 diabetics. Well, Munch in the new lab will help me tremendously, because doing research with exercise and looking at changes in meal composition, to have a facility where we can prepare the meal or have an expert prepare the meals for us, have a place where we can have subjects come in not just on that given day to get fed, but to get meals beforehand will help just the control in the studies dramatically. To also have a facility with clinical support available to us, or a facility that we can closely monitor the subjects like this is very, very nice. And to keep them comfortable, because I keep my subjects here usually for about 12 hours. So the nicer the facility is, it helps dramatically. 210 helps dramatically because this is where we analyze all the samples. So to have a high quality lab, I really like the aspect that it's a shared lab, because one, it gives access to more equipment that I wouldn't have necessarily if I was on my own. And on the other thing, it allows for collaboration to talk with people who are in that lab that also do animal-related research, and one, to learn from them, but also to enhance what I'm doing. Well, the unexpected is different than necessarily some novel that we might have planned on. I mean, a study that I thought we did years ago that was really quite interesting is we looked at the effects of exercise at different times a day on hormonal control and regulation. And I did this years ago in my postdoc, and it was really quite interesting because we had expected dramatic differences. We had these individuals exercising at midnight, 7 a.m. In the middle of the day, and they would complain about how much harder it was at different times a day, and yet it wasn't. Physiologically, when we saw it, we saw no differences between it. So that was kind of a big surprise. And it was kind of novel, and it was actually one of the first studies that really started using this repeated bouts of exercise model in the research as a physiological stimulator. The thing I think that was kind of fun for me to see, which was in a completely different study where we were exercise training subjects, what we did was we brought in a group of obese individuals, type 2 diabetic individuals, and we created this training program where they came in and trained with us 1 or 2 days a week at the beginning, and then they had to do at least 2 days a week on their own. And what I learned from it was you really need to educate them on how to exercise, but when you did, they got it. They got it, they could stick with it. And what was fun to see, we didn't really do weight loss with it, that most of them, when they left our study after 16 weeks, could definitely maintain it, and many of them started losing weight because all of a sudden they began to figure out how to manipulate their diet. Even if it was ever so slightly, it was enough. And unfortunately, that was not the data we were collecting for the study, but it was really, really obvious what worked.